Hello, dear aquarist. Again, you're watching my case on fish diseases. Maybe it's the first you're watching? Well, I made already 354 cases on fish diseases, and maybe you can check to find the species of fish that I examined. I listed them in different playlists on like tetras or cichlids or gouramis or barbs, you can call it. And today it's about the goldfish. And maybe you like goldfish or you sell goldfish. Goldfish are very popular, but also popular in breeding. Well, all the goldfish are pond raised. A few are tank raised. But that is also a risk of creating or breeding diseases. And that is something I emphasize in several of my studies and several of my cases that we have a problem in breeding facilities that breed fish with diseases. And today I'll show again a fancy goldfish that is suffering from a bacterial infection causing massive tubercles, most likely Mycobacterium or fish tuberculosis. And the fish also had flukes. My books on fish diseases also talk about goldfish, also about all different fish and also available in different languages. And the new illustrated guide specifically talks in detail about goldfish diseases, also koi carp, fancy goldfish, about the diseases that are common in these variety of fish and how to diagnose with a lot of photographs and what kind of medications you can apply. The link is below where you can order them. Here I show you the damaged goldfish. The black one has a big red wound and a bump on the dorsal. And the calico has a bad eye, inflamed reddish eye popping out, damaged. So two different signs of or wounds caused by something that I can only identify when I use a microscope. With my naked eye, we would say, well, it's a wound, I give an antibiotic. Yes, might help. But in this case, the problem was more serious than just an external wound. We took a scraping from the fish and we found already tubercles in some of the tissues we scraped off. Some skin tissue was invaded with tubercles, and here also one scale with a tubercle inside. The gills were in bad shape, a lot of extra mucus, some deformed gills. Some gills had gill flukes, the big gill flukes here, causing damage, causing a risk of infiltration of bacterial infections, more other kind of bacterial infections. Internally, we found tubercles in the organs, in the liver on the left, on the right here in the kidney, all tubercles causing serious damage. Here in detail, the liver. Not much healthy tissue is left over. It's invaded with tubercles, large tubercles, small tubercles. This is something I've rarely seen, so big amount, or I mean such expanded large tubercles, and also in the spleen. That is causing the weakening of the fish, prone to more other kind of infections because the organs are invaded with bacteria and the capsules are made, the tubercles are made by the organs to defend against the invasion of those bacteria. So the badly damaged fish that are suffering badly, you should put them gently asleep or euthanize. Some fish might be less infected and with proper good care can have a good, longer, healthy life, well, or semi-healthy. They might still have some tuberculosis, but they can survive it as long as you take good care of the fish. Usually an antibiotic has no impact on the fish infected with Mycobacterium because the bacteria is encapsulated and no medication can go through the tubercle. The anti-fluke treatment will be necessary to kill the gill flukes. Watch out when you treat gill flukes because they lay eggs and they can come out after 7 or 10 days. So you have to retreat, follow the directions of the medications you obtain. A functional fish food can help to improve the immunity and repair of the fish. In this case, I would recommend Dr. BASSLEER BIOFISH FOOD FUCO. My books help you to understand fish diseases, prevention, diagnosis, and what medications to use. The link is below. If you want to get more training, specific on quarantining fish or good diagnosing, go to my Patreon channel. Here is the link. And I hope this video helped you to understand what kind of disease a goldfish can suffer from. Just having some wounds, well, we are recommended, like most of the books tell you, to use an antibiotic. But in this case, the antibiotic will only save some of the fish, but not handle the problem with the tubercles, and that is created by the breeder. The breeder is breeding this problem inside the fish. I have several videos on that. Look at my specific video on fish tuberculosis, where it comes from, what you can do about it. And I'm happy you watched until the end. That means you want to learn more and that you learned maybe a little bit more today. If not, try to subscribe, try to like this video. I appreciate watching and following me on my content on fish diseases. Take care of your fish. Bye-bye.